Hi, what's up, guys? Assalamualaikum, madam. What is on the news today? So, my name is Hanif, and today, me and my fellow group members, Isha and Karudin, we were going to explain and summarize the topics that we have learned recently in the E-class, which is about the theory of prevention, model in rehabilitation, and pathology of injury and disease based on our own understanding. So without wasting any more time, let us proceed to the content. Let's
Assalamualaikum. My name is Irshad. Okay, today I want to tell you about the topic theory of prevention model in rehabilitation. Okay, what is prevention in sports? Alright. It is to improve the benefit, the risk of ratio in physical activity and sport. Like we know, in sport there are many injury that can harm us. So we as athlete, we must do the prevention to reduce the risk of injury to ourselves. Alright. Okay. Injury prevention can be categorized as three, which is the first one is primary, the second one is secondary, and the third one is tertiary. Okay, we go for the first one. The first one is the primary. Okay, for example, it is include health promotion and injury prevention, such as wearing ankle braces. Alright. Okay, if we know that we have the ankle injury or like ankle injury, okay, we must use the ankle braces to protect our ankle to become worse. So we use the ankle braces. Okay, for the second one is the secondary. Alright. The secondary is include early treatment such as RISE. Okay. RISE is stand for rest, ice, compression, and elevation. Alright. Okay, and lastly is the tertiary. Okay, tertiary is focus on rehabilitation to reduce an existing disability. Okay, now we're going to the systematic injury prevention model. Okay, for the first one, we have 4 steps. Okay, for the first step is establish the extent of injury. Second one, establish the etiology and mechanism of injury. And the last one, and the third one, introduce a preventive method. And the last one is to assess the effectiveness by repeating step 1. Okay. Alright, so we go to the comprehensive injury causation model. Okay, we have 3 factor of injury, which is the first one is the internal injury, the internal factor. The second one is the external factor, and lastly is the inciting event. Okay, for the internal factor and external factor, it is caused by the predisposed athlete. Okay, what is predisposed athlete? Predisposed athlete, okay, what is predisposed athlete injury? Okay, it is caused by their attitude, action, or their condition. Okay, now we go for the inciting event. Alright. Inciting event is caused by the susceptible athlete. Okay, what is susceptible athlete injury? Okay. Their injury is caused by a particular thing. Okay. Now we go for the internal factor. We go for the deep internal factor. Alright. Okay, internal factor is caused by age, gender, body composition, health, physical fitness, anatomy, and their own skill level. Okay. Next we go for the external factor. Okay, for the external factor, normally it is caused by human factor. Protective equipment. Yes, we play sport, we must use the protective equipment to protect ourselves. Okay, next is the sport equipment. Okay, for example, like hockey, American football. Okay, they have their own protection equipment for us to wear. So we must wear the equipment to reduce ourselves from getting the injury. Okay, and then lastly is the environment. Okay, environment. For example, if we play sport on the wet floor, it will we will slipping and fall down. It will cause harm to ourselves. Okay, for the second example, in Europe, okay, they have winter. So if they play sport like football, okay, on the field, when the winter fall down to the grass, so it will be wet and slippery. Then it will cause the player then it will cause the player will get injury easily. That's all.
So, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Khairuddin bin Nur Aziz. So, I will continue about the injury prevention model, which is appropriate surface. Appropriate surface. So, we need an appropriate surface, especially our shoes, because we need to avoid the injury, which is the most always happening is ACL. So we need an appropriate surface to avoid the injury. So after that, we have appropriate training. So training is the main activity that will lead to increase the performance of athlete. So there are four general principle of the training, which is periodization, specificity, overload, and individuality. So for the training method, there are seven, which is anaerobic, strength and power training, flexibility, speed, power and speed, agility, and skills. And for adequate recovery, an athlete need to rest to get full benefits from the training, or the athletes will get injured if he didn't get enough rest. And after that, we have psychology and injury prevention, which is excessive arousal and under arousal. Excessive arousal means that if the athletes overwork performance, that athletes can get injury also. But also if the athlete is under arousal, it can also leads to injury. For an example, if that athlete didn't warm up as normal when that athlete is competing in the lower level of competition. And after that, we have nutrition and injury prevention, which is if the athlete take an inadequate nutrition, it can also lead to injury. For an example, if the this is specifically for the female athlete, if they are having an eating disorder, it can result in stress fracture.
So now we are moving to the second topic, which is the pathology of injury and disease. So without wasting any more time, we are going to head on to the second topic, content. Let's go.
First, I would like to tell you about what is the pathology. So in science, the pathology means the what is the cause and the effect of the injury. And pathology also tells us on what deals with the knowledge of what caused the disease, how the disease start, the progress, the process of healings, and more. Of course we need to understand the healing process, which is important, which is the first one is primary injury. Primary injury is either acute or chronic injury, and it also can come into two forces, which is macro trauma and micro trauma. So macro trauma is acute, and it will produce immediate pain, and will produce immediate pain, such as dislocate, sprain on your ankles and more. And another one is micro trauma, which is chronic, for an example bursitis and tendinitis. So after the primary injury, it is followed by the secondary injuries. So the second one is inflammatory response phase, which means by once the tissue covered, once the tissue injured, the healing process will start immediately to to the injured part lah. So it is characterized by, so it is characterized by which is category by the redness, swelling, and increase on temperature. So on the inflammatory response phase, so what happened on inflammatory response phase? So there will be two, which is the first one is vascular reaction, and the second one is formation of clot. Formation of clot means that in the end of the result of the formation of clot, the injured area is like wall off from the injury. And for the third one, which is fibroblastic repair phase, which is the one is healing aerobically, and it will increase oxygen and nutrients to injured site. And for the fourth one, which is maturation remodeling phase, for the last one, so the last process is the scar will be visible, but the scar is not as strong as the normal tissue, and the scars will need to take about several years to complete the whole lot of process. So thank you.
Alright. Okay, Assalamualaikum. Okay, I'm back. Okay, now I want to tell you about the stages of wound healing. Okay, the stages have 4 stages, which is bleeding, inflammatory, proliferative, and remodeling. Alright. Okay. Now we go for the factor that influence the healing process. Okay. For example, like muscle spasm, edema, extent of injury, separation of tissue, poor vascular supply, infection, oxygen tension, health, age and nutrition, and lastly atrophy. Okay. Next we go for the classification of body tissue. Alright, we have 4 tissue, which is the first one is epithelial tissue, second one is the connective tissue, the third one is the muscle tissue, and the lastly is the nerve tissue. Okay, we go for the first tissue, which is the epithelial tissue. Right, epithelial tissue. What is epithelial tissue? Okay, epithelial tissue is the tissue that covers internal and external body surfaces, such as our skin outer layer of internal organ, and inner lining of blood vessel. Alright, okay, what is the epithelial function? Alright, it is function for absorption and secretion. For example, the digestive tract and the glands. Okay, now epithelial tissue also contain no blood supply, and it depends on the process of diffusion of nutrition and oxygen. Okay, what is the injury that caused by the epithelial tissue? For example, the injury is abrasion, lacerations, punctures, and avulsions, and lastly, infection and inflammation. Okay, the second tissue, we go to the connective tissue. Okay, what is the function of the connective tissue? Okay, it support and provide body framework, fill space, storage of fat, protect against infection, and help repair tissues. Okay, there are 6 types of connective tissue, which is, the first one is fibrous connective tissue, the second one is the cartilage tissue, the third one is reticular connective tissue, the fourth one is elastic connective tissue, the fifth one bone, and the lastly is blood. Okay, ligament sprain for connective tissue. Okay, a ligament is a tough inelastic band of tissue that connects one bone to another. Okay, grade of sprain in connective tissue, we have 3 grades. The first grade is some stretching or tearing of ligament, mild pain of or stiffness. Okay, the second one is grade 2. There is some tearing and separation of ligament, moderate to severe pain, swelling. Then the third grade is total rupture of ligament, severe pain or no pain at all because disruption of nerve fibers. Okay, ligament healing for connective tissue. It follow the same healing process as vascular tissue. Okay, for the first 72 hours, sometimes there are no loss of blood. Okay, the next 6 weeks, vascular proliferation occur, formation of the scar, and after several months, the scar continues to mature, and it will heal the injury. Okay. Next, we go for the muscle tissue, the third one. Okay, muscle tissue. We go for the muscle strain and muscle healing. Okay, for the muscle strain, muscle tissue is tendon is overstretched. This is what is muscle tissue. What tissue injury. Okay, when the tendon is stretched, it is exceeding the normal ability. So ligament damage, grade of sprain, we have 3. We also have 3. Okay, the first one is some muscle or tendon are actually torn, pain and tenderness. Okay, for the second grade, some of muscle or tendon have been torn, active movement is painful. And lastly, total rupture of tendons, total loss or impairment of the limb. Okay, muscle healing for muscle tissue. Okay, like before this, still same. We must follow the same healing process as the vascular tissue. Okay, for the muscle tissue, within a few days, there is a vascular proliferation and myoblastic cell formation occur. Thus, process regeneration begin. And lastly, the nerve tissue. Okay, what is the nerve tissue? Okay, the nerve tissue provide sensitivity and communication from CNS to muscle and sensory organs. Okay, in sports medicine, injury to nerve usually involve either contusion or inflammation. It also can lead to physical disability, paraplegia or quadriplegia. Okay, for the nerve tissue, within the first 3 to 5 days, the nerve begin to degenerate and break into irregular segment, and it regenerate process of neuron is slow at rate only 3 to 4 millimeter per day.
Hi, I'm going to explain about the healing process through rehabilitation. So there are basically 4 phases, but this one particular phase is excluded among the other 3 phases. So this one particular phase is known as the pre-surgical exercise phase, and followed by the phase 1, phase 2, and phase 3. So first of all, I'm going to explain about the pre-surgical phase. So that heads on to the first point. Pre-surgical exercise phase. So the objective of this phase is to ensure the individuals who participate in this pre-rehabilitation program regain the function and return to their daily lives as soon as possible. So that is the main objective of this phase. So we can tell that there is a waiting time prior to any surgery involved. So this time can be very crucial and very valuable to the person who are going through a surgery. So it can be utilized to prepare the body for surgery and facilitate a better outcome after the surgical intervention. So when the muscle, bones and joints are in optimal condition before the procedure of the surgery, the impact of the inevitable muscle loss and joint stiffness is minimized. So essentially, the stronger a person going through surgery, so the better the chances of an easier and faster recovery after the surgery. So that is basically about the pre-surgical exercise phase. So now we are going to the next phase, which is the acute injury phase. Now let's go. So phase 1 is known as the acute injury, and it is also known as a inflammatory stage, and it occurs at the time of the injury. Okay, so during this stage, the symptoms of inflammation, which include redness, swelling, pain at rest, and also loss of function will likely occur. So at this point of phase, the objective is to make sure the swelling, the redness, to be reduced. So they want to reduce the pain and swelling at this phase. So they implemented the price principle in this phase. So this phase usually takes up to 48 hours. So now we are going to phase number 2. Let's go. Phase number 2. Phase number 2 is also known as the repair phase. So this phase is usually on the 3rd day or the day that is the swelling is stopped. So that is the point where we continue to the phase 2. So in this phase 2, connective tissues and capillaries that help to repair the damaged structures and decrease the inflammations that occur due to the injury that we experienced in the first place. So at this moment, healing process is generated, which allows scar tissues to be formed. So this particular scar tissues that also helps the repairing process. So in this phase also, we need to implement the aerobic and resistance exercises to make sure these individuals can regain their function. So last but not least, we are going to the last phase, which is the remodeling phase. So let's go. So lastly, the remodeling phase is aimed to make sure the individual is completely on form or physically prepared to come back to its sport activity as usual, with no pain, no suffering, and so on. So that is the ultimate goal of phase 3. So this phase 3 will take a while to complete, as it can last for several years, and it is the longest phase among the other 2 phases. So basically that's all about this phase. I've covered up and explained what I understand from this slide that I read. So thank you and have a good day ahead. See you again. Bye bye.